State Senator Jo Comerford won the seat previously held by former Senator Stan Rosenberg this past fall in a successful write-in campaign. The Northampton Democrat sat down in the studio with Carrie Saldo for a wide-ranging discussion, including her proposed legislation related to the opioid epidemic. But Carrie began by asking the senator about a meeting she had with the governor's office earlier this week.
The governor actually didn't attend in the end, but his representatives were there. So actually one of the bills I filed in partnership with Rep. Natalie Blais, and she represents First Franklin. And Natalie and I were very concerned about the shutdown and the impact of the shutdown on people in our district, so federal workers, federal contractors, but not only that, right? Because the ripple effects are profound. Because when federal workers are out of work, then the folks with whom they're in conversation, daycare workers or other service providers, are also out of whack. So the economic impact was pretty significant.
So, as I understand it, that bill would ask for a committee to be assigned or to look at the impact of the shutdown on Massachusetts. Now that the shutdown is up and running, or we came back out of the shutdown, do you still see a need for that committee to address this work?
It's a really good question. So that bill that Rep. Blais and I filed, it was the first bill to pass in the session in the House. And the House took it up. The Senate decided to form a working group. I submitted the order for that. And so we have a Senate working group on the shutdown and the House members who are interested in Rep. Blais' bill. So yesterday we met with the governor's people, the different agency heads, and we talked about the lingering impacts of the shutdown, even though it has ended. And, and we hope one is averted at the end of this week. There are significant impacts. For example, we've seen a spike in our food banks across the Commonwealth. So I had a conference call yesterday with food bank heads and food security advocates talking about the drain on reserves that food banks have seen. So that we're looking to address the lingering impact even as we prepare and have the Commonwealth do a better job for its people, for its municipalities that were also affected, for small businesses that were affected. We can and should step forward in a much more public way, which was essentially what the bill was asking. A bipartisan support, a very public support for workers, for affected communities by the Commonwealth.
You talked about some of your priorities moving into this new two-year session. One of the bills that you filed would propose something new related to the opioid epidemic. Yes. It would be a 3-year pilot project that would distribute fentanyl test strips. How do you see that possibly helping address this problem?
Thank you for asking about it. It's incredibly important. So it's a classic harm reduction strategy. We understand now that fentanyl is present in an overwhelming percentage of opioid-related fatalities. And so this would say to people who are using opioids, let's test to see if fentanyl is present. And just like other harm reduction strategies, that brings them into a conversation with providers. So it's not unlike a needle exchange, right? It's saying, hey, what you're doing could potentially really harm you.
People who are using the opioid would actually need to use the test strip in advance of taking the drug. So it wouldn't stop them from using this illegal substance.
No, but it would. The hope would be, and the science tells us it's true, that it would cause them to have to stop for a moment and actually really reflect on what they're doing. And it would also cause them to be in conversation with providers.
As I understand it, the way you've proposed it, Health and Human Services would be charged with kind of running the pilot program, setting it up. Right. Do we have any sense of cost?
As a bill moves through committee, if there is a cost attached, and there would be one, after it is out, it reported out, and we hope it's reported out favorably, it would go to a second committee. So, and probably in this case, it could go to, say, for example, a House or Senate Ways and Means, depending on which side it's reported out on.
To look at that numbers issue.
Exactly.
And when you say reported out, just for the folks at home who might not be familiar with that phrase, it would basically get a nod, get the approval,
right, exactly.
Move to the next step. Doesn't
mean
mean it would be passed, but it would just be moving through that legislative sausage factory in some ways, if you will. There's lots of moving parts, right?
Exactly, right. And then we'd get a number attached to it. And then after that, right, the bill could potentially come to the floor for consideration.
Something else that kind of goes hand in hand with this is looking at the continuity of mental health treatment. And the concept here, as I understand it, is that people could continue receiving care even if their insurance dropped that doctor or provider. Do you have any sense of how often that's happening, that you wanted to propose legislation attached to it?
We're looking into that now to get the hard numbers. We have a lot of anecdotal data. In many ways, it's a kind of a no-brainer bill, meaning that we know that behavioral health care is really important, right, for people. And it's important for people across a continuum of reasons why people seek behavioral health care. But if it's interrupted in these episodic insurance switches, which happen, often these days, as companies seek different providers with potentially lower costs, then people have a real a lack of a continuum of care, and we know a continuum of care is necessary.
Something else happening around behavioral health, mental health in the region is Bay State came out with news that they're going to be building a new hospital. They say there'll be about a 30% increase in the number of beds overall, but they're also considering, or most likely, to consolidate that into one hospital instead of the 4 that it currently has, many or some that are in your rural areas. Yeah. Are you hearing concerns? Are you concerned?
I'm hearing a lot from constituents about this, and I am. Yeah, we did. We wrote.
Do you think it's a mistake for Bay State to go to one hospital instead of these disparate locations?
I can't call it a mistake yet. What I'll just say to you here, and I really appreciate you flagging it, is that one of the things I'm going to look at are the number of people currently, say for example, up at Bay State Franklin, who are inpatient, right? What we understand from Bay State, we wrote a letter and we got back some responses, which was I was grateful for. What I understand is that they're keeping the outpatient services in Bay State Franklin, but it's really the inpatient. Okay, that's a good piece of information, but we know that one of the barriers that we have to accessing services in our region is public transportation. So I'm concerned about that intersection of not having local provision of inpatient behavioral health at the same time as folks, if they depend on our public transportation system, not being able to reach loved ones. Say, for example, if they have a family member.
Quickly on balance, Bay State doesn't know where that hospital would be,
Exactly.
That centralized hospital. So more information to come on that.
Exactly. I think we understood that it's going to move south potentially, but right, they haven't, and they just announced. So no one's saying that they have to know where it's going to be, but certainly we're all eager to hear this and to be in deeper conversations about mitigating any impact.
Just one final thing I want to ask you about quickly.
Sure.
You also proposed legislation around a millionaire's tax, which the Supreme Judicial Court last year struck down and said the state can't do it. How would what you're proposing get around that or be different?
So I didn't propose that legislation, but I did co-sponsor it. Yeah. So my colleague Senator Jason Lewis did. It's really just a legislative pathway. So the Supreme Judicial Court said that citizens couldn't determine the spending of the money that would come from the millionaire's tax, but the legislature could. So my colleague Senator Lewis said, okay, great, we'll do that. I do have a couple of revenue bills. One I am very interested in, which actually the governor's interested in as well, which actually he proposed as a version of it in his budget, which would actually tax luxury real estate. So real estate over 300%, it would give cities and towns the option, 30% of median, to make that tax. And there's a lot of provisions for agriculture, for family to family, for seniors, so that we could really look at unintended consequences and mitigating them. But it would invite cities and towns to have the opportunity to do that, to create a fund for affordable housing in the district. So I'm interested in that, in the Commonwealth.